Ladies and gentlemen, welcome once again to another episode of the Think Monica podcast. My name is Hamza. It's always great to be here. It's another beautiful Saturday morning here, and today we are going to be looking at a couple of things around just how you can build efficient measures, what tools are there for you, and most especially how you can build a clinical operating system. Because when you are able to look at these things objectively, you do realize that there are certain businesses outside of healthcare that have been able to build what I call clinical operating systems correctly that help them to scale. And today we're going to look at just the logic behind some of these and whether there is an opportunity for these to be replicated in healthcare. How can we use some of these best practices from some of these other businesses that are in the healthcare space to be able to really build efficient, well-oiled operating systems that will be able to help our healthcare businesses scale. So today, this is what we're going to be looking at. How do you build a clinical operating system? What does that even mean? Because when we look at businesses outside of healthcare, and I'm going to use Netflix as an example, they built an operating system that learns what you want to watch before you know it. So that's why Netflix has a capacity to suggest things to you. When we look at a business like Amazon, they're just not selling you products. It's creating a platform where every click you make or every click you do makes the entire system smarter. And it actually helps the next customer that is coming in. So how are these systems working, and how can we translate this to healthcare? So when we look at this today, we'll be exploring what how we turn traditional businesses into what I call clinical operating systems. And the whole idea of clinical operating systems is that you want to create a system that is self-improving and that gets more efficient with every patient interaction. So you have a system which just gets smarter and smarter, like you have with Netflix, which is able to tell you what or suggest things that you may want to watch. As far as your watching history and your pattern or your previous watching experience is concerned. So this is what we're going to be looking at today. So the first part of this is going to be looking at what we call platform businesses or the platform business model, and we're going to look at this in the context of healthcare. So if we look at the platform business and what a platform business is, so basically this is a business that creates value by facilitating interactions between different groups. So when you look at a business like Airbnb, it's connecting a host to a traveler. So these are platform businesses, and we are trying to look at how this applies in the context of healthcare. But before we even know, we can even go deeper into how this would translate into healthcare, we need to look at who is interacting with who in the healthcare space. Who are the players in this space? And because once you understand who is interacting with who, then you're able to understand how to create the value using the platform business model. So first of all, there's a patient, right, who is seeking care. For every single healthcare institution, there's always a patient or somebody who's seeking help, who's seeking care. Now it goes further to now, who are they looking for the care from? They're trying to get connected to providers, right? And the third phase of it is that between the patient and the provider, there is an administrative system that is managing that flow, that is making sure that that patient, from the time they identify the provider till the time they get to the provider, that process becomes seamless until the patient leaves. For any other transactions that happen after the patient, for them to be eligible to come back again, and the cycle continues. So there's an administrative system, right? And there's a data system that drives decisions. So these are the four components that actually come together to be able to make up a clinical operating system. So if we want to create a platform business where we want to facilitate interaction between different groups in healthcare, these are the different groups that need the interaction. You need the patient interacting with the provider, but with an administrative system that manages their workflow, and then the data insights that would drive decisions within the organization. Now, when we look at the network effect in clinical practice, most traditional businesses that face diminishing returns So basically, unlike those traditional businesses that will face diminishing returns, most platform businesses actually get stronger with each scale. So each patient or each new patient interaction should make the entire system smarter, and it should make it more efficient, right? So a lot of these things and are backed by a lot of studies. And if you look at the 2023 Stanford study, for instance, practices operating with platform principle, where one patient interaction is making the system smarter and is making it more efficient and is making the next patient's experience better, data usually would flow between different areas. It will flow from the patient side of things, where the patient is coming in. It will flow from the staff side, where there's a lot of workflow conversations that need to happen, and it will all be put together into some feedback system that would help you to improve your system. Now, when you have these interactions on a platform system or a platform business, it's achieved a 45 higher patient satisfaction and 38% better staff retention. So when you land on the principle of platform businesses, it's easy for because each interaction is making your system smarter. So that, first of all, the staff are happy because they don't have to go through the painful process of trying to figure out how to make the system smarter, or going back to do the same process without getting any value out of it, or additional value out of it. And you also have patients who are satisfied because that interaction that made the system smarter has been able to improve the patient experience for the next person. So now we are going to look at the 3-layer clinical operating system. And we are going to look at all the layers. The first layer is the experience layer, so that's the topmost part of it. And when we talk about the experience layer, this is your user interface. This is every touch point that a patient has with your practice. So you can look at, instead of being like reactively scheduling your patients, you can actually do very predictive patient journeys, because when these platforms happen, they actually anticipate patient needs before they call. They are able to predict what the patient's journey should look like based on what they have been able to say, or based on certain keywords or certain conversations that have happened either with other patients or in the past, right? So a family practice, for instance, will typically schedule well-child visits 2 to 3 weeks before school starts, right? But the clinical operating system, if it's put right, can automatically send messages or personalized scheduling prompts in early July. Now, this will result in 67% fewer rushed against appointments, because the system is able to predict what needs to be done, so that you don't have this rush or this difficulty for patients to come in. So you're able to see the same volume of patients for the same need, just because the system was able to predict. So you're not reactively scheduling these patients. It's able to predict what needs to be done. Now, when we move away from the first layer, which is the experience layer, we move to the logic layer. This is where the practice thinks, and the rules, the workflows, the decision trees. These are the things that we are looking at, all these things that govern operations in the practice, right? So that's the logic layer. Practices will use what we call static scheduling. But when you look at platform-based businesses, they use what they call dynamic allocations. This is why when you book an Uber, for instance, it's able to tell you the cost based on driver availability, and it's able to share all these things in real time. When you do static scheduling, you don't get that same feature, but on platform-based practices, this becomes dynamic. This becomes real-time updates based on what this real situation is, right? So a dental office, for instance, in Seattle, currently implemented that level of dynamic appointment slots. So which this will automatically adjust based on historical no-show patterns, right? Based on weather information, based on local events. So it's constantly updating based on these different activities that in the past have been able to influence no-shows. And the result of it is that there was a 23% improvement in schedule utilization, and the practice did not have to overbook anyone. So that's the second layer. The second layer falls on the practice, where the practice now has to think. You have to look at your rules. You have to look at the workflows. You have to look at decision trees that really govern your operations. So the first layer is just on the experience. Anywhere there's a touch point with the patient. The second layer is on you as a practice and what your operations look like. The third layer of it is the data layer, where every interaction generates data that improves future interactions. And that's what we are trying to talk about here. So each patient visit should generate insights that improve the next patient's experience. And then you track patterns in appointment preferences, you track treatment outcomes, and you track operational bottlenecks. So when you track these things, anything that what time do patients usually like to come in, what are the treatment outcomes that people are getting from specific procedures, and what are the operational bottlenecks that are commonly coming up. If you're able to track these, then it takes you to the third layer, because that insight is able to improve the outcome or the experience for the next patient. So now when we look at the third component of this whole clinical operating system, we are looking at, okay, how do you build network effects in your practice? And you ask, you probably be thinking about, okay, do network effects even apply to healthcare practices? Yes, they do. First of all, network effects are just phenomena that where each new user makes the product or service more valuable for the existing user, right? That's all that it is. Now, when you have clinical network, you are looking at examples. So you are looking at referral intelligence networks, for instance, where you are not keeping a static list of providers that you usually refer to based on specific specialty needs, but your system is able to take data from the outcomes, probably let's use outcomes, the outcomes you've had from previous referrals or patient experiences that you've had from previous referrals, and it's able to help you make a more informed decision on who the preferred referral source would be in your next one. So a primary care provider, for instance, in Texas, built the specialty network, and where real-time outcome data and patient feedback created an improved referral system for him. So this is what it does for you as a primary care provider or a primary dentist, is that your patient experience doesn't just lie on you. It lies on the recommendations that you also make in terms of when their specialty needs arise. And when this happens, it has an amplifying effect, because this patient is going to come back to you. Not only that, they are going to now create more value for you by recommending more patients or more people who might be interested in coming to see you for specific services. We have staff expertise amplification, where traditional individual staff develop separate skill sets. But when you look at the platform approach, they create knowledge sharing systems where every challenging case becomes a learning material for the entire system. So the knowledge is not siloed. This is what that means. It's not siloed. So people are able to get access to the same level of information, same level of expertise as far as your staff is concerned. So the last bit of this, we're going to talk about clinical API strategy, and this is just the way, and when we talk about API, we're talking about application programming interface. So you set protocols that allow different softwares to be able to communicate and share data seamlessly. So you do not want your systems to work in silos. So basically what this will mean is that when you are thinking about your clinical API strategy, think of your practice as having an API endpoints, where the endpoint system connect the patient portal API, which is a self-service access, the provider workflow API, which is the clinical decision support, the administrative API, which is billing, scheduling, compliance, and all those good things that come with administration, and the community health API, which connects directly with the population health insights, right? So if you can get these set up, then this is how, and the components of the clinical operating system that you need to get together to be able to get that system that connects your four players, or that facilitates interaction between the patient, the provider, the administrative team that enhances workflow, and the data insights that actually would inform everything else. Now let's move on to look at the clinical operating system and just understand the fact that this has a compound effect on like generally. So what we are saying is that if you standardize these clinical operating systems, you have better patient experience, which will lead to more referrals because these patients are going back to recommend you. You are going to get more data from those more referrals that are coming in, which is going to make your system better because you give better insights. Now that insight that your system is getting, because it's learning from it and it's using it to improve the next patient outcome, you're going to have your whole operations improved. And it goes back to the loop of improving better patient outcomes. So even makes patient outcome even better. And that will go back to even increase more referrals. And it just keeps, so it's a compound effect that you need to really understand when you engage in a framework like this. Now, anytime you're thinking about the future of healthcare, please bear in mind that this isn't just about better treatments. Right now it's about getting systems or the better systems in place. Whilst others are still thinking about in terms of individual appointments and isolated services, you can build what we call a clinical operating system. And when you look at all these components that I'm talking about, you need to create a system where the patient, the provider, the administrative team, and the workflow that the administration team creates, and the data insight that's driving decision can interact on one. And that means that you need to start thinking about how you build these platform-based services where each patient experience is going to influence the experience of the next one, because it's just going to make the system even better. And once you're able to get to that, you're able to get that dialed in, you can always get the kind of feedback you want from your patient group. So you don't need to start with all the three layers. I know we talked the experience layer and the data layer and the logic layer and all that. You don't need to start from all layers. You can actually just start from one layer. And then maybe let's talk about dynamic scheduling. You can just start from that, because that's the experience layer, and that's a touch point for patients, and build from there. If you think about starting all three layers, you are building the patient experience as well as the logic side of it at your practice level, and the data is going to get too much for you and your team at the beginning. So you have to think about which layer is more important to me at this point. Start and then take it up from there. This has been another episode of the Think Clinical podcast. Feel free to leave your comments down below, and we will see you in our next episode.